Did you know that nearly 1 in 5 people ignore the early warning signs of serious leg and foot conditions? When it comes to blocked arteries, these symptoms can be easy to overlook, but they shouldn't be. Ignoring them can put your heart health at serious risk. If you're feeling pain, numbness, or other strange sensations in your legs and feet, your body could be sending you an urgent message. Today, we're going to talk about the 7 warning signs of blocked heart arteries in your legs and feet that you must know to keep your heart and health in check. Recognizing these signs early could make all the difference, saving you from serious problems down the road. So, stay tuned as we break down each sign in a way that's simple and easy to understand. That way, you won't miss out on any of our important health tips that could keep you and your loved ones safe. Now, let's dive in and find out what your legs and feet might be trying to tell you. Pain or cramps while walking. One of the earliest signs of blocked arteries in your legs is a sharp pain or cramping that happens when you walk, run, or climb stairs. This condition is known as claudication. It usually feels like a muscle cramp in your calves, thighs, or buttocks. The pain might start mild, but can become more intense as you keep moving. What's interesting is that this pain often goes away when you rest, only to come back when you start walking again. Why does this happen? When arteries are blocked, blood can't flow easily to your muscles. This means your muscles aren't getting enough oxygen when they need it the most, like during exercise. Just like a car that runs out of fuel, your muscles can't keep going without enough blood supply. If you notice this kind of pain regularly, don't ignore it or think it's just due to being out of shape. It could be your body's way of telling you that something more serious is going on. Getting checked by a healthcare professional early can help prevent the problem from getting worse and protect your heart in the long run. Coldness in one foot or leg. Feeling a noticeable chill in one foot or leg compared to the other can be a sign that your arteries are blocked. When blood flow is restricted due to narrowed arteries, less warm blood reaches your limbs, causing them to feel cold to the touch. This coldness often affects one side more than the other, which can be a strong clue that something is wrong with your circulation. This symptom might be more noticeable during cooler weather or when you're sitting still for long periods. Sometimes it's easy to dismiss this as poor circulation from sitting in a bad position, but it can signal a more serious issue like peripheral artery disease, PAD. When your legs and feet don't get enough blood, they struggle to maintain a normal temperature. If you regularly feel one foot or leg is much colder than the other, don't ignore it. It's a sign that your blood isn't flowing as it should, and that could put you at risk for more severe problems, like heart disease or even a heart attack. It's crucial to get checked by a doctor to find out what's causing the issue and to start treatment before it gets worse. Numbness or weakness in legs. Numbness or a feeling of weakness in your legs can be a clear sign that your arteries might be blocked. When blood flow is limited due to clogged arteries, your nerves and muscles don't get enough oxygen and nutrients, causing them to function poorly. This can result in a tingling sensation, numbness, or even a sense that your legs are weaker than usual. This kind of numbness is different from the temporary pins and needles feeling you get when sitting in one position for too long. Instead, it's persistent and tends to worsen when you walk or exercise, and then eases up when you rest. For example, you might notice that your legs feel heavy or shaky when you try to climb stairs or carry groceries. Ignoring this symptom can be dangerous. It may lead to more serious conditions like tissue damage or sores that don't heal properly because of poor blood flow. Numbness in the legs can also increase your risk of falling or losing your balance. If you're experiencing these symptoms often, it's important to seek medical advice. Early diagnosis and treatment can improve blood flow, reduce discomfort, and help protect your overall heart health. Slow healing sores or ulcers. Sores or ulcers on your legs or feet that take a long time to heal are serious warning signs of blocked arteries. When your blood vessels are clogged, there isn't enough oxygen-rich blood reaching your skin to help with healing. As a result, even a small cut or blister can turn into a sore that just won't go away. These slow-healing sores often appear on the lower parts of your legs, ankles, or feet. They might start as small wounds but can grow larger, become infected, and take weeks or even months to heal. Sometimes they can look red, swollen, or have a crusty surface. If left untreated, these sores can lead to more severe problems like tissue damage or infections that are hard to control. This sign is more than just a skin issue. It's a clear signal that your blood circulation is compromised. Without enough blood flow, your body's natural healing process slows down or stops completely. If you notice sores that aren't healing like they should, seeing a healthcare professional is crucial. Early treatment can help restore proper blood flow, prevent complications, and protect your overall health from further damage. Shiny skin or hair loss on legs. One of the often overlooked signs of blocked arteries is shiny skin or hair loss on your legs. When blood flow to your lower limbs is reduced, your skin and hair follicles don't get the nutrients they need to stay healthy. This can cause the skin on your legs to appear unusually smooth, thin, or shiny. You might also notice that hair growth on your legs and feet has slowed down or even stopped entirely. These changes happen because the restricted blood flow affects your skin's ability to regenerate and support hair growth. For example, you might notice patches where your leg hair seems thinner or has fallen out altogether, or that your skin has a glossy look that wasn't there before. These symptoms can sometimes be mistaken for normal aging, but they shouldn't be ignored. When your arteries are clogged, your body struggles to deliver oxygen and nutrients to the skin, which is a red flag for your overall circulation health. If you observe these changes in your skin or hair, it's a good idea to consult a healthcare professional. Early intervention can help restore blood flow, prevent further damage, and reduce your risk of more serious health issues down the road. Discoloration in feet or toes. Discoloration in your feet or toes can be a key warning sign of blocked arteries. When blood flow is restricted, your feet and toes may not get enough oxygen, causing the skin to change color. You might notice that your toes or feet look pale, bluish, or even have a darker tint compared to the rest of your skin. This happens because the lack of blood flow makes it hard for your body to deliver oxygen and nutrients to the area. These color changes often become more noticeable when your feet are cold or when you've been sitting or standing for a long time. In some cases, you might also see red or purple patches on your toes, which can indicate poor circulation. If the problem worsens, the skin might become darker, showing signs of tissue damage. It's important not to overlook these color changes, as they can be a sign of peripheral artery disease, PAD, or other serious conditions affecting your blood vessels. If you notice any unusual discoloration in your feet or toes, it's a good idea to seek medical attention right away. Early diagnosis and treatment can help improve circulation, protect your heart health, and prevent further complications. Thickened toenails. Thickened or slow-growing toenails can be a sign of blocked arteries in your legs. When blood flow to your feet is reduced, your toenails don't get enough oxygen and nutrients, which affects their growth and overall health. As a result, your nails might become thick, brittle, or discolored. They may also grow more slowly than usual or develop a rough texture. This condition, often mistaken for a fungal infection, actually happens because poor circulation weakens the nail structure. Without proper blood flow, your body struggles to support normal nail growth. You might also notice that your toenails appear dull or yellow, and they may crack or break more easily. Pay close attention if your toenails change in appearance without any clear reason, like an injury or nail infection. It could be a clue that your arteries are not delivering enough blood to your lower limbs. Ignoring these changes could mean missing a warning sign of peripheral artery disease, PAD, or other serious circulatory problems. If you see these changes in your toenails, it's best to talk to a healthcare professional. Getting the right diagnosis and treatment can help restore blood flow, improve your nail health, and protect you from potential heart and vascular issues. What to do if you notice these signs? Taking action immediately is crucial if you notice any of these warning signs in your legs or feet. The first step is to schedule a visit with your healthcare provider. They can perform tests to check your blood flow and determine if blocked arteries are the cause. Early diagnosis is key to preventing more severe issues like heart attacks, strokes, or tissue damage. Don't ignore these symptoms or assume they'll go away on their own. Untreated blocked arteries can lead to serious complications. In the meantime, keep track of your symptoms. Note when they occur, how long they last, and if they worsen with activity. This information can help your doctor make a quicker and more accurate diagnosis, leading to better treatment options. Preventative tips: preventing blocked arteries starts with a heart-healthy lifestyle. Regular exercise, like walking or cycling, can help keep your blood vessels in good shape. A balanced diet rich in fruits, vegetables, whole grains, and lean proteins reduces cholesterol and improves circulation. Avoid smoking as it damages your blood vessels and significantly increases your risk of artery problems. Managing stress and maintaining a healthy weight are also important steps. By making these changes, you can improve your blood flow, reduce your risk of heart disease, and keep your legs and feet healthy. That wraps up our list of the 7 warning signs of blocked arteries in your legs and feet. Remember, paying attention to these symptoms could make a big difference in your health. If you've ever experienced any of these signs or have questions about what we talked about today, let us know in the comments below. We'd love to hear your stories and offer any help we can. If you found this video helpful, be sure to give it a thumbs up and share it with friends and family who might benefit from this information. And don't forget to subscribe and hit the notification bell so you never miss our latest health tips. Before you go, check out our other video on how to improve your heart health naturally. It's packed with simple tips to keep your heart strong and your arteries clear.